to get to this point of having her was such a journey that it made me feel like this is too good to be true. Hi guys, welcome back to my channel. For those who don't know, my name is Khadija Lisa. I am a recording artist. This is also my daughter Naima. I just gave birth to a baby girl, and on my YouTube channel I document my journey with fibroids to becoming a mom, as well as my recording journey and just my life as a woman. So I wanted to come back and give you guys an update on what's going on. So baby girl, she is now a month old. I actually just had my 6-week checkup, and I wanted to fill you guys in on everything that's been going on. For starters, Naima is doing well. She is gaining weight. She has actually gained about 1.5 pounds when I went to her 1 month checkup. Normally I know babies don't have a 1 month checkup. She had an appointment right after we came home from the hospital, and then we were told to come back in a week. When we came back though, she was a little bit more jaundiced than she was the week prior and to when she left the hospital. So for those of you who don't know, jaundice is when you have an increased level of bilirubin in your body, and it often happens with babies. In the hospital, they can apply a blue light to babies who are extremely jaundiced, and it just gets it out the baby's system. But she was well. She was fine in the hospital. We didn't need that. And she came home and she was fine. But it started to increase as she came home. Sometimes I found out afterwards that breastfed babies, they have a tendency of having an increased level of jaundice than babies who are not breastfed. How the doctor checked, she touched the baby nose, and then if it blanches and it turns kind of like a whitish color, then that's normal. But if it looks yellowish, then that's jaundice. And hers was yellow at the first visit. But then when we came back for the second visit, it also spread to her chest. So we were told to go to the lab and have her levels checked, and they were more increased than they were when we left the hospital. So we were told to put her in front of a large window that gets a lot of sunlight without any clothes on, just her diaper. You don't want to do it just outside because babies can become sunburned, so you want to make sure that there's some type of barrier, and that does the same thing as the blue light in the hospital, and that will cause her levels to decrease. So we did that, and I was also told to feed her as much as possible. She was actually kind of sleepy though when we first came home, and I'm not sure if that had anything to do with her jaundice, because she was taking long naps for hours during the day, and she was sleeping for large stretches during the night as well. So she didn't get as much breast milk as I guess her doctor would have wanted, and we were told that if we wanted, we could have supplemented with formula just to give her a boost. I told the doctor I don't want to give her formula. She did tell me that I could pump and try to give her a big dose at nighttime. I didn't do any of that. I just tried to feed her more. We found out that her weight was perfect. She got right back to her birth weight, which is great because baby's weight does decrease right after delivery. As long as it's not more than 10%, then it's fine. She was 5 pounds 14 ounces, and I believe the lowest she got to was 5 pounds 7 ounces. So, and then after that she just went back up. So she was back to her 5 pound 14 ounces. So the doctor was like, everything's fine, but her levels didn't decrease. They decreased 0.1%. So the doctor told us to again do the treatments and everything, and then bring her back. So at her last appointment, I found out that she had actually gained quite a bit of weight, and she was 7 pounds 6 ounces. So the doctor was really happy about that. The doctor did say that she looked a little jaundiced still. Her eyes were still a little yellow, so she wanted her to have her levels checked one more time. So this was going to be the third time that they checked her. I felt so bad because Every time they would prick her, it would hurt my heart so bad. She would scream. It hurt. I just felt so bad that they were hurting her. So I was hoping that that would be the last time we would have to do it. And we found out that her levels had dropped like 50%. So she was doing really well. The doctor said, don't worry about it. By her next appointment, which would be at her 2-month checkup, she's sure that her eyes are going to be clear. She won't have any more of the bilirubin in her system. And as of right now, her eyes are perfectly white, clear. Her skin looks normal. It's not yellow. So I'm really happy about that. So she's doing great. She's able to hold her head up now. She's been smiling. She's cooing. So we're really happy. So she's doing great. However, what I haven't talked to you guys about is I actually ended up developing preeclampsia right after coming home from giving birth to her. So for those of you who don't know, because honestly I wasn't aware, preeclampsia is a condition when you develop an increased blood pressure due to either being pregnant or just giving birth. So I always thought that preeclampsia, that you only got that during pregnancy. I had no idea that after giving birth, you're susceptible to getting preeclampsia at that point too. So what happens is with preeclampsia, you end up getting an elevated blood pressure that can cause... Hey, baby girl. An elevated blood pressure that can cause you to have a seizure. It's interesting because in the hospital, no one actually told me that. They did tell me things to look out for, but I didn't know why. So let me just say what the symptoms are for preeclampsia. So they tell you when you come home to monitor for these things. They say shortness of breath, for chills, for a headache that is not going down with the pain medicine. They say if you're seeing any flecks, like specks in your vision, to look out for that. And any others I'm gonna put here because I don't actually remember all of them. But they tell you to look out for these symptoms when you come home from the hospital because you're at risk of developing preeclampsia. But I didn't know that you can get preeclampsia after giving birth. So we went in on a Thursday, we came home on a Sunday. Sunday, at some point during the night, I ended up developing a headache. And I didn't think anything of it, but I did think it was a bit strange to myself because I was taking pain medication at that point. Since I had a C-section, I was taking my narcotic as well as taking 2 extra strength Tylenol pretty much around the clock. So I did find it a bit odd that I ended up developing a headache because normally Tylenol on its own would get rid of a headache if I had one. During that night though, I ended up getting chills. I woke up in the middle of the night, it was around 3 o'clock in the morning, and I had chills. I was literally shivering, and I took my temperature, it was normal. So I was like, is there something going on? This is odd for me. I did check my discharge paperwork, and it did say to contact my provider if I do develop chills. So I thought, okay, let me see how this night goes. If this doesn't go down, if it doesn't go away, then call my doctor in the morning. However, it went away after about maybe 20 minutes or so, and it didn't come back for the rest of the night. I was fine. So I woke up, I didn't think anything of it. I was like, that was just some weird occurrence that happened, and I kept it moving. Then Monday, which is the day we had to bring her to her first appointment, I ended up developing a headache again, and I still didn't really think anything of it. I just, like I said, thought it was weird. It never got too bad that I felt it was urgent, so I didn't think anything. However, that night, I was having a difficult time breathing, and it was so weird. I kept waking up out of my sleep, gasping, trying to catch my breath. It felt like I couldn't breathe at all. It literally felt like when I was laying down, there was just pressure on my chest. Like I couldn't fully expand and get a full breath in. So that was so weird and kind of scary as well. But I went through the rest of the night, and in the morning I told my husband, I said, hey, I was having a really hard time breathing last night. I think that I should go to the doctor. And he was like, okay. But neither one of us really wanted to, because this was literally the first day that we had been able to just be home without an appointment. Like, it was supposed to be our first free day. However, around 11 a.m., I laid down with Naima to take a nap, And again, I woke up gasping. I could not breathe. And I was telling him, no, there is absolutely something wrong. So I do have a blood pressure cuff, and I put it on, and it said it was like extremely high, like 160 something over something. And I'm like, okay, this can't be right. Something's wrong with this cuff. And my heart rate was actually low, like in the 50s, and that was strange for me. So I was like, all right, you know what, let me check my husband's blood pressure. Let me see if his is normal. His was normal. So then I thought, wait, there isn't anything wrong with this cuff. I checked it again, and I was like 160 over something. And I was like, oh my God, I have to go to the hospital. I called my primary care physician, and I told them what was going on. They told me I wouldn't be able to bring my daughter with me to get checked out, that I can come, but I can't bring her. So I was like, wait a minute, I just gave birth to this girl a few days ago. I can't be without her. I'm breastfeeding her. I have to bring her. They told me I have to either go to urgent care or go to the emergency room. So at this point, I'm really afraid. I don't want to be separated from her. Just hearing that that's an option, that I might have to be separated, that just horrified me. I said, all right, let's just go to urgent care first and see what happens. We went to urgent care, and they told me they are not even going to check me. If I just gave birth and I'm going through this, I need to go back to the hospital. So I was like, oh my God. And I'm crying, and we, of course, go to the emergency room. We have no formula. I have like the little sample formulas that you get in like the little care packages from the baby registry stores. So thank God we got there, and they were like, yeah, absolutely, she can stay with me. And I went right up to the maternity unit, right where I came from. So I was admitted, and at that point, they didn't know for sure if I had preeclampsia or if I had they didn't know exactly what I was dealing with, because the fact that I had difficulties breathing and how I described it, they didn't know if there was any fluid in my lungs. However, it was more likely for it to be preeclampsia, but they had to make sure, because if they treated me for the preeclampsia, the treatment that they provide, it could have made the other issue worse if that's what it was. So they wanted to make sure they knew exactly what they were dealing with. So I ended up having to get a chest x-ray. It was just a lot. And at this point, I'm in the hospital and I'm crying. Like, I almost had a panic attack. At one point, I was kind of rude to one of the nurses, which I felt really bad about, but I was just like overwhelmed. I was just horrified, thinking, oh my goodness, what if something is actually wrong with me? And I just gave birth to my baby girl, and the idea of her losing me, I don't know why I had this thought before giving birth to her. It just felt like to get to this point of having her was such a journey that it made me feel like this is too good to be true. Like, am I really having a baby? Is it all really working out? Like, it just felt like, oh my God, like, when is something gonna happen to like throw this off? So now when things are actually up in the air, like this could be going on, that could be going on, I didn't know what was happening. Blood pressure, I never have issues with my blood pressure. I don't have issues with anything normally. So now I'm like horrified if something's actually wrong with me and she lost me, how horrible that would be for her, and how I would feel so bad that I couldn't raise her, and how she needs me. Oh my goodness, it was just, I was just in a really, really, really bad place at that point. Thank goodness all of us could stay. Actually, the only reason why my daughter could stay was because my husband was able to stay too. So I am so grateful. Oh my goodness. I mean, he had to be there because no one could watch her. If I have to be treated, I can't watch her. The nurses cannot be responsible for watching her like they were when I had first given birth. Like, I was discharged, so it's a different situation. So they were going through the whole process of finding out exactly what was going on. Got the chest x-ray. They started giving me medications to lower my blood pressure. Before I gave birth, I had gone up to 184 in weight. All that water weight, I hadn't lost it yet. They started giving me jaundice, and they tried me on one dose. Nothing happened. My blood pressure did not decrease, so they gave me more. Nothing happened again. So then they tried me on something else. At this point, though, I started using the bathroom, and it didn't occur to me, jaundice, that's a diuretic. So I started going to the bathroom like crazy. And it was literally like as if only water was coming out of me. Everything was just clear. It was crazy. So they're trying me on different medications. Finally, they gave me one that actually works. This one is the medication that I actually ended up going home with. It's called, let me just say this. I had to be my own advocate. I recommend for every single person, if you ever end up going to the hospital, please pay attention to everything. Listen to your gut. Don't just go with what other people are saying. So pay attention and pay attention to the names that they're telling you. And don't just let them give you anything and just do anything to you. No. So finally, my blood pressure starts going down and my chest x-ray comes back clear. So they tell me that it most likely is preeclampsia. They want to start the treatment. So the treatment for preeclampsia is magnesium, and they give it to you through an IV for 24 hours. So that means for 24 hours, you have to be stuck to a bed that you cannot get out of because they have to run this IV continuously for 24 hours. So I was like, wait a minute. So now I'm about to be in a bed for 24 hours, like can't get out, cannot use the bathroom. So they have to catheterize you again. This time, however, at least when I had my C-section, they catheterized me and I was not even able to feel it because I was numb. So I'm like, oh my God. Then they also told me I couldn't eat anything for 24 hours. I was like, wait a minute. At this point, I had only eaten breakfast. Mind you, the drip didn't start until 9 p.m. And I had only eaten breakfast because, like I said, it was morning time. It was around 11 a.m. when I took my nap and I woke up realizing there was actually something wrong. It took hours to get to this point. And I have to breastfeed. The point of me having my daughter was so I can feed her. So I'm like, what? They were like, you can drink, obviously, because I'm catheterized. They don't have a problem with that, but they don't want me to eat much. Luckily, though, they ended up coming back and saying it's fine for me to eat. They let my husband go out and he left with my daughter to go and pick up food. I have to say, it was so crazy when he left with my daughter because this was the first time I was apart from her. And I was just like, oh my God. And he had to take her because if he was leaving, there was no one there to watch my baby. And then the 24-hour hold started. But let me tell you, it actually ended up being a 2-day hold. Because like I said, I had already been there for hours. I think I made it to the emergency room around like 3 p.m. So it ended up being a whole 2-day hold because after they give you the magnesium for 24 hours, then they have to check and monitor you. So that ended up being a whole 2nd day. How the magnesium drip goes, oh my goodness. They started in the first 30 minutes, they give you a high dose of the magnesium. And it just makes you feel crazy. Like they describe it as you feeling like you have the flu, but you feel hot, like all over your body, just inside, internally. I still had a headache and it was getting worse throughout the night. So they started the drip and I started to feel crazy. They were like, it's normal. And after 30 minutes, it'll get better. And they were right. And then it was just, being in the hospital, pretty much bored. I mean, the TV worked, but it was crazy. So let me get into the hospital personnel. I'm there getting the drip overnight and I'm being introduced to it felt like every single person that worked in this hospital. It was doctor after doctor, nurse after nurse, this person, that person. When I tell you, it was literally like every 30 minutes, somebody was coming into my room for something, whether they were checking my reflexes, which they have to check because the magnesium can have an adverse reaction where you stop having reflexes. So they do the tap here and in your knees. And I'm not sure what was happening, but I got to a point where I had to tell everyone they needed to start coming in together because it was too much. The entire night, I couldn't get any sleep because then my daughter is there and I have to feed her every 2 hours. She's waking up and she wants to be fed and she needs to be changed. So if it's not her crying and waking up, then it's them coming in and disturbing me. They're coming in loud. I'm like, oh my God, please, settle down. I understand that they were working night shifts, but I needed my daughter to sleep through the night. I appreciated all of the love that I was getting because they were coming in and everyone wanted to see her. They were like, oh my God, she's so beautiful. And, just gave me so many compliments, like she has so much hair. And that was all wonderful and all, but I'm like, I really just want to get some sleep. And I literally was getting none. And I felt that way both times I was there. When I stayed for my C-section, it was crazy. They would come in and be like, try to get some sleep. And I'm like, well, am I supposed to get some sleep? Y'all keep coming and bothering me. But that second time with the magnesium, that was the worst, because it just felt like torture. You're stuck in a bed, and it's like some type of mental challenge. Hey guys, okay, so I'm back. While I was editing, I realized that there was an issue with the footage. I literally lost all of the rest of the footage. So I'm back to just finish up explaining to you guys how my 6-week post C-section journey, how it went. So where I left off, yes, being in the hospital was definitely a mental marathon. It was like being in a race with yourself mentally. The first time when I was giving birth to my baby, people were just coming in left and right. Sometimes they would knock on the door to announce that they were coming in. Sometimes they wouldn't. I was just laying there with, like, my breasts are out the whole time because I'm feeding my baby all the time, and they're just strangers coming in and out. At one point, some man literally walked into the room, didn't knock to announce he was coming in, walked into the room, looked around, and then just left. That was it. We have no clue who that man was. We were just like, what is going on? And it was happening at all times throughout the day, throughout the night. So that was rough. And then the worst of it was absolutely when I had the preeclampsia and I was stuck to the bed. That one was crazy. So we made it through the whole 24-hour being stuck to the bed and getting the magnesium. It was just pretty boring. Day 2, as I said, once the treatment was finished, they wanted to monitor me for a day just to make sure everything was good, that my blood pressure stayed within normal limits, and that I didn't have any adverse reactions to the magnesium. So finally we were able to go home, and that was just wonderful. I was sent home with the medication that they gave me in the hospital, and I was told to take it for 6 weeks until I had my 6-week checkup with my doctor. My doctor that delivered Naima, he actually came in to discharge us so that we can go home, and that was really nice. It was nice seeing him. He said to me, he was like, I guess your pregnancy just went too easy. He was like, I guess things were just too perfect, huh? Because literally I had no problems throughout my entire pregnancy. But he discharged me. I was sent home with the medication that I was taking in the hospital that works, and I was told to take it all the way until my 6-week appointment with my doctor. My blood pressure stayed good, and I actually didn't take my medication all the way through the 6 weeks. After a month, I was supposed to get a refill, but I just kept forgetting to pick up the medication. We just were really busy, and we just kept forgetting. I took my own blood pressure at home a few times, and it was always the normal range. So I just thought, like, okay, if I just wait another day, it won't be an emergency. And it ended up just happening at some point. I was like, well, at this point, I might as well just wait for my appointment because it's been so long and my blood pressure is fine. So I'll just wait to see what my doctor says. So this brings me to my actual 6-week appointment that I just had with my doctor. When I first got in, they had me fill out a questionnaire that was checking basically to see if I had any postpartum symptoms. I've been feeling great. Thank God, I've been great. So I was good on that. Then they brought me into the office, checked my weight. I ended up being 159. So from my actual 184 pre-delivery weight, so I was happy about that. My pre-pregnancy weight is actually 140, around there. So still have a little ways to go to get back down to my normal pre-pregnancy weight, but I was 159. They checked my blood pressure, and my blood pressure actually was 120/80. So when I met with my doctor, he was like, do not take your medication. You're good. This actually made my job so much easier. Obviously, he wouldn't recommend someone to stop taking medication on their own, but because he knew I was good. Because had I come in taking the medication and still got that reading, he wouldn't know if my blood pressure was because I was taking the pills or if that's just how I naturally am. So He's like, don't take the medication. He checked my incision site, everything. He said it's healing beautifully, so I was really happy about that. Baby girl was actually there with me for the appointment, and it was nice. Everyone got to see her, and they were just like, oh my gosh, she looks just like you. It was nice because all of these people were there for my entire journey, and now they got to actually see the baby. And my doctor, it was beautiful. He said to me, he's like, I want you to know, like, this is actually really rewarding for me too, because he was my doctor that removed my fibroids. And he's like, to go on this journey with you, from you coming in wondering if you're ever going to be able to have children and performing the fibroid removal surgery, the myomectomy, to now having a baby right here in the office with us is just really rewarding. So I love my doctor. He is incredible. I actually have to make sure I go and give him an amazing review. He's incredible. Like, he is literally an angel on earth. I love my doctor. But he said everything is good. I'm healing well. No issues. He did ask me, like, at this point, how I wanted to handle maybe birth control, and he explained to me that I wouldn't know when I would first ovulate because I'm breastfeeding. And he's like, I don't know how long you plan on breastfeeding, but he's known people to not have a period all the way for the first year of the baby's life because they're breastfeeding the whole time. So he did tell me how breastfeeding can prevent me from getting pregnant, but that also will mean when I actually become fertile, I won't know. But that's something to think about later on. But everything he said is healing great. The only thing I can say is I am having like abnormal coloring. Like, my complexion is still very different. I'm like a brown rainbow right now. Like, if I can show you guys my stomach. So if you see like how it's really dark, this actually was like the whole stomach. And yeah, I have still a little gut here. I still look like I could be a couple months pregnant or just extra fat, but that's okay. We just, you know, taking this thing in stride and enjoying each and every moment of this. Honestly, like, my little gut, I'm fine with that. This whole thing is a blessing. So, but I do plan on working to get everything right and tight, but just not this very moment. But yeah, my discoloration, my doctor explained it that melanated people during pregnancy, the hormones causes our melanin to just kind of go crazy, and that's just what happened there in that area. It was very weird at first because I didn't see my stomach be like this throughout my pregnancy. It was literally after I delivered, it just became this really dark, grayish, black, ashy color. Like, not a regular tan brown. It was like a grayish, like, and I'm like, what is this? He was like, well, you know, when you have the linea negra, that happens, that's melanin. But for me, basically that whole area just became dark. So that's that. But honestly, everything is going great. I'm so blessed and so happy. I hope you guys enjoyed this video. If you made it this far, thank you so much. If you haven't already, please give this video a thumbs up if you liked it. And I will see you in my next one. Thank you so much for watching.